Hello, guys. Good morning and welcome to another AMA session. I'm Dr. Behnam. I'm a board certified dermatologist and founder of Happy Head. So, welcome to our AMA right before Valentine's Day. So, before we get started, I'd like to remind everyone that this information is for educational purposes only and is not meant to provide medical advice. Please do not rely on this information to make any medical decisions and remember to discuss the risks and benefits of any treatment with your medical doctor before starting treatment. So, the way it's gonna work is that we're gonna ask, I'm gonna read some questions, and then we're gonna answer them, and you guys also get a chance to ask the question as well. So, what is the sign-up process like? So, the way that Happy works is that you have to really think it's like a medical office. So, the way it works is that you get on the website, and we have to, just like a doctor's office, we have to get your medical information. So it's going to ask you for some medical questions, your past medical history, family history, what is your hair loss about, how long you've had it, what are some of the medications you've tried, or some of the medications that have failed. Once you do that and you submit those questions, it's going to ask you to upload your photos because we do want to see basically how you look like. Although I think we're kind of we're getting away from that. I think from now on, there's also a choice in the upcoming weeks where you could just say, "Oh, this is how I look like." A couple of different photos. You said this is how you look like, so you don't have to upload your photos. Then I think as of right now, we still have some of the patients upload their driver license for verification purposes. But I know in the near future, the system will automatically basically just verify you as well, so you don't have to do that anymore. And then all that information gets submitted, and it goes to a doctor on the back end that reviews your photos, your medical history, your prescription history, and based on that, he or she will customize a prescription happy medication just for you, send it to a pharmacy, and the pharmacy will send it to you. So that's how the process starts. So now, do you have to be on a subscription? So usually, in order for the hair to grow out, it's going to take several months. So we usually say that it takes 4 to 6 months for you to see results. So to make it easy for you guys, this is Happy is a subscription service where it's an auto ship. So you don't have to do anything, but we automatically will do everything on the back end. So we'll charge your card on a monthly basis, prepare your product, customize it, and ship it out to you. It just makes your life easier. But you can always change that subscription, and you can always go on every other month or every third month, whatever you want. Just let us know, and we'll definitely do it for you. Just email us at help@happyhair.com. Are there any gender, age, or ethnicity requirements? There's really no requirements. I mean, we have patients from age 21 and above to age 70s that do it. We service all ethnicities, light skin to dark skin individuals, and basically both genders, so all genders, so it's all perfectly fine. Can I talk to my assigned dermatologist? Yes, you may. The best way to communicate with our dermatologist is through chat. So you could get on basically your portal and basically chat with the dermatologist and ask questions. If you have any non-medical issues, you can also chat with our own customer service, which is help at Happy Head. And if you have any questions or you want to basically put a pause or customize your prescription, or if some of the ingredients are irritating you, please contact us and we'll be more than happy to help you. Does it work on patients that are completely bald? The answer is no. I mean, if you're completely bald, you have no hair for it to grow. These medications work on patients that basically have the peach fuzz hair. We have some hair, so it's going to basically strengthen those hairs. If complete bald, it's not going to work. But again, you can always submit your photos and your questionnaire. And if you're not a candidate, we'll always cancel and refund you. So, and that way, you even got a free consultation from a doctor. What is the best starter product? So the product of the year is dutasteride, guys. So we used to prescribe a lot of finasteride, but dutasteride in clinicals has been shown to actually be more effective. It's better at blocking the DHT, and in clinicals has been shown to cause more hair growth. So we love our dutasteride products. So we have a topical dutasteride that's fortified with minoxidil and retinoic acid, and we also have our oral dutasteride super capsule with a combination of dutasteride along with minoxidil and vitamin D. And again, if you're not ever sure, basically our doctors will decide for you, and sometimes patients will do a topical and oral together. We know as the fact that combination does basically help patient get better results, but that may not be for everyone. So please submit your consultation. The consultation is free, is included in the price of the product, and our doctor will evaluate your hair loss, will evaluate your medical history, and based on that will customize a product just for you. Is hair loss genetic? Yes, it is. So this is why when you fill out the questionnaire, we do ask about past medical history and your family history. It is genetic. Is happy had prevented it? Yes, it could be. So obviously there are patients that have a lot of hair, but in order to prevent like additional hair loss in the frontal hairline or in the crown area, they use happy to prevent to prevent the hair loss. How will I know when my shedding has turned um, into hair loss? So that's a very good question. Well, basically, so you could be shedding hair and people could lose up to about 100 hairs a day, but you could also grow that 100 hairs a day as well. So in that scenario where you're shedding less than 100 hairs a day, you're not really leading to hair loss. But let's say if you're shedding 200 or 300 hairs a day, then your cumulative hair loss out is more than the amount of hair you're growing on a daily basis. So that's going to lead to hair loss. So it really depends on how much you're shedding and how much are you really growing out. What ingredients are in the vitamins, and do I really need to take four a day? That's a great question. So um so to achieve the right level of dosage of those vitamins, you need to take four a day. There are some patients that actually take two a day and they do just fine. For optimal results, basically it's four a day. The ingredients in it, actually, do we have one of the vitamins here? Oh yeah, we do. Oh, perfect. So it's saw palmetto, collagen, keratin. Oh, perfect. Thank you so much. So, guys, here's the multivitamin. So, and we formulated this. Basically we looked at like a lot of vitamins out there. We also looked at clinical studies, and we saw what's really needed for hair loss. So, the vitamins that basically we have in here is biotin, and biotin is very important for hair growth. Collagen, saw palmetto, probiotics. Which actually, I don't think any other vitamin has that. Um, Vitamin A and vitamin D, which is very critical. Keratin, as well as my favorite ashwagandha. That's my favorite one. But basically, all those and plus more stuff. So, but the vitamins, two capsules in the morning, two capsules at night, and the recommended dosage is that I want you to take it every day. The key is to be consistent on the vitamin. So I have patients that come in like, doc, if you have to choose between the shampoo or the vitamins, which one would it be? For sure, the vitamins. What is the best time to apply the topical medication? It's morning and night. It really doesn't have to be 12 hours apart. Just whenever you get a chance, just put it and rub it in. It really takes 30 seconds. How does liposomal work? So the liposomal formula is made only for finasteride. The whole purpose of the liposomal formula is that the vehicle itself, the liposomal vehicle, prevents unnecessary additional absorption of finasteride into your bloodstream. Is basically just reducing the absorption. And by doing so, it reduces the systemic side effects of topical finasteride. The question people always ask is that how come we don't have it for dutasteride? One, is very difficult to make a liposomal dutasteride, and number two, dutasteride is a much bigger molecule. So it doesn't, so that already being such a big molecule, it's less likely to be absorbed through into your bloodstream when you apply to the scalp. Do you recommend taking oral and applying topical medication together daily? Look, everyone's different, and you really have to be evaluated by a physician to make that decision. But we know as a fact that when patients do both topical and oral, it's called sandwiching, and those patients typically get better results because you're taking the medication orally, which is going to have the systemic effect, and when you do it topically, it has this local effect on where the hair is. Uh, Now, in the clinic, I have patients who, let's say, who have been on finasteride for like 15 years, and they come in and it has plateaued. So the effect of the oral finasteride has plateaued. So what I do, I add topical finasteride to it, and also it just sparks a new set of hair growth. And again, and that's the reason why doing a topical and oral basically could lead patients better results. Clinically, that's what we see. Um, how effective is the happiness shampoo and conditioner? Well, look, the shampoo and conditioner were designed by dermatologists, basically for the best to get the most effective hair growth. Obviously, alone by themselves, I don't think they're magical. But when combined with the multivitamins and the Happy Head topical and the Happy Head super capsules, all combined together, they do help quite a bit. Personally, I really love the conditioner quite a bit. My wife steals it from me all the time in the shower. So, but yeah. So, what is the ideal hair care routine, and how often should I be washing my hair? So I think you should wash your hair every day, but don't shampoo every day. My recommendation is to kind of shampoo like every other day, and I think that's that's good enough. Now there are some exceptions. For example, let's say if you work out every day, you're working out twice a day, and you get very sweaty, yeah. So then you need a shampoo every day. There's some patients that have very oily scalp or oily hair. Then in those cases, you need to shampoo every day. Um, so now, and the hair care routine is, don't really mess with the hair a lot. So don't put it in tight braids. Don't get the blow dry at the highest heat settings. All those could damage your hair. Now, can Avodart be taken with finasteride? So there are really no clinical studies that taking dutasteride with finasteride will help you a lot. I mean, finasteride inhibits 5 after reductase 2, and dutasteride inhibits that enzyme plus another one. So when you take dutasteride, it's already inhibiting what finasteride already inhibits. There are some patients that might do like dutasteride 5 days a week and finasteride 2 days a week. I've seen that. Again, I don't think there's really any clinical study basically that shows that's really effective. So in my personal opinion, you're either taking dutasteride orally or taking finasteride orally. Now, happy we do have a formula where it's dutasteride and finasteride combined together topically, but orally we don't have that and we don't recommend it. Do you recommend a dry shampoo? So dry shampoos are kind of for patients that have very oily scalp. So you could do basically dry shampoo, which is kind of which is a leave-in shampoo. There's also yeah. So what is the advanced formula and how is it better? Advanced is the combo. Is that what it? Yeah. So the advanced formula is a combination of dutasteride and finasteride combined together. And look, some patients do say really, it does help. It's a little more expensive and it's not for everyone. And my recommendation always is to start with either dutasteride or finasteride first before moving on to the advanced formula. My hair is very sticky after applying the 8% minoxidil. Is there anything I could do to avoid this? The reason why it's sticky is because there's aloe in it. Is a non-aloe formula. Please contact the help desk, help@happyhead.com, and just tell them to take out the aloe, and we'll ship you out a new one. That's a very good question. What makes Happy Head different from other companies like Hims or Keeps? Well, many reasons. One of the most important one is that we customize the product just for you. So see, other companies they mass produce these products and they're sitting on the shelf for honestly months to years. We produce this basically on a very short-term basis, literally sometimes monthly basis, because it's a compounded drug and it's customized just for you. So let's say if you don't want something in it, like let's say you don't want the aloe, we'll make one just for you and ship it out for you on a monthly basis. So that's what makes us different. And also we have other products and ingredients that the Hims and Keeps don't have. So we have dutasteride, which actually in clinical studies has been shown to be a lot more effective than finasteride. So we have topical dutasteride. We also have the dutasteride super capsule. So we have other ingredients that help patients achieve better hair growth. Why can't Happy ship to Europe? That's a great question. We currently don't have any doctors in Europe basically to write the prescription. It's really honestly another. It's a lot more complicated from a medical regulatory standpoint. Where is Happy office located? So the office is located on Santa Monica Boulevard in Los Angeles from West LA, where actually is right above our own personal medical office. So if you ever pass by Barrington and Santa Monica, please honk. Can I pick up my Happy Head from the LA office? Unfortunately, you cannot. It really does have to be shipped from our distributors on the East Coast. Um, how did Happy get started? Great question. So the Happy product was actually in our own personal office ever since 2017, and it took us really 2 years to really perfect the formula. And then we launched Happy on April of 2019. It was April of 2020. Literally the day after we shut down from during COVID, we launched Happy Head, and it kind of just slowly grew, and now we have this amazing team, of everyone really helping to get Happy Head out, the word of Happy Head out there. Are there optimal DHT levels in the blood? So that's a very good question. The answer is really no, because there are some patients that have very low DHT and are bald, and some patients have really high DHT levels and have amazing hair. So the DHT level and testosterone level doesn't always correlate to basically how your hair looks. And the reason is because when you have the DHT binds to a receptor called the DHT receptor, and it's that DHT receptor that really determines um, basically how bald you're gonna get. So the higher the affinity of that receptor to DHT, unfortunately, you're gonna lose more hair. Where are the Happy products made? All Happy products are made in the U.S. We have two pharmacy manufacturers on the East Coast. So, and they're the one that manufacture all of our products, and they're the one that distribute it. We actually do visit the pharmacies all the time, but these are your not local mom and pop 1,000 square foot pharmacies. These are huge pharmacies, and they actually make a lot of our competitor products too. So, the only couple of pharmacies in the U.S. that could make uh, really so much products in a monthly basis. So, all right, guys, new products announcements. So we are we are coming out with our super capsule dutasteride with minoxidil that has already been out. Again, this is the year of dutasteride, and the reason is because in clinical studies it's been shown that dutasteride is more effective than oral finasteride in basically causing more hair growth. We know as a fact that dutasteride inhibits the 5 alpha reductase 2 inhibitor three times more than finasteride, and it inhibits the DHT production 90% compared to 70%. And we also have our topical dutasteride as well, and we have a lot of patients that do the topical dutasteride along with the dutasteride super capsule, so that sandwiching. So what is dutasteride? So dutasteride is an FDA-approved drug that is used off-label for hair loss. And what it does, it inhibits two enzymes as opposed to one, where finasteride only inhibits one. It is better than finasteride for many reasons I just basically talked about. Can I start dutasteride and skip trying finasteride? Yes. We believe that dutasteride should be the number one drug because it actually works better. So why would you want to waste your time with something that's just inferior? Now, why would a doctor recommend dutasteride over finasteride? Well, many reasons. Dutasteride has been shown to be clinically better, and there are some studies suggesting that the sexual side effect on dutasteride could potentially be the same or even less than finasteride. Also, topically, dutasteride is a much bigger molecule compared to finasteride, so it's believed that it's less likely to be absorbed and have caused systemic side effects. What is the super capsule? So the dutasteride super capsule is a combination of dutasteride, minoxidil, and vitamin D. Dutasteride is a DHT blocker. Minoxidil increases blood flow to the scalp, and the vitamin D, basically, I think everyone needs vitamin D. And the way they work is that you're trying to really target hair loss in as many different stages, so you get better hair growth and you have a much more better hair journey. So, um, now, do hair lasers work well, and do I recommend them? So, in my opinion, I think the lasers are about like 50-50 or like 60-40. They don't work in everyone, but they could complement what you're currently doing. So, if you're currently doing the topical and the oral medication, the hair lasers could really help complement that, just like the Happy Head multivitamins and Happy Head shampoo. Remember, there's not just one reason why people lose hair, there are many reasons. So the more stuff you could throw at it, the better results you're gonna get. So let's talk about the new Super Capsule ED Performance. So what is this? So first of all, this is a medication that's just for men. It has three ingredients in it. One is finasteride, which is a DHT blocker. We know that one of the side effects of finasteride is that it could potentially have risk of sexual side effects, such as decreased libido as well as erectile dysfunction. So we added tadalafil. Tadalafil is generic for a brand name medication called Cialis. Cialis is a drug that's very similar to Viagra, and what it does, it is a medication that is used for ED. The reason why we decided to add tadalafil into the mix is two reasons. One, some patients who have sexual side effects from finasteride could take this new medication, which will help their ED. And number two, there are some studies out there showing that topical version of Viagra could increase blood flow to the scalp and cause more hair growth, just like minoxidil. So there's both. So it's being added for both a hair growth benefit and also to reduce some of the sexual side effects from finasteride. That's the reason why we added tadalafil, and then we added vitamin D to it as well. So our new super capsule ED Performance contains three prescription ingredients: finasteride for hair growth, tadalafil for possible hair growth and reducing the side effects of finasteride, kind of counteracting that, and the vitamin D. So I'm worried about sexual side effects. Will the super capsule ED Performance help? Yes. If you're worried about sexual side effects, that's why the super capsule ED Performance was created, to reduce the risk of sexual side effects associated with finasteride. Are there side effects associated with tadalafil? Yes, everything has side effects, as we know. The most common side effect of tadalafil is